Bismillahirrahmanirrahim. Today's lecture is about the wrist joint and hand articulation. First, we need to revise the bony structure of the hand. It is formed of 27 bones in 3 levels or 3 sets of bones. The first set of bones is called the carpal bones, which are 8 in numbers, starting from the lateral row. The first bone is a scaphoid leonate, and we have 2 bones overlapping each other here, which are the triquetrum and pisiform. In the second row, we have the trapezium, trapezoid, capitate, and hamate bone. The 8 bones are called the carpal bones, and they are articulating with each other by intercarpal joints, which are plain synovial joints. The second type of bones in the hand are the metacarpal bones, which are 5 in numbers, starting to count them on the lateral aspect. The metacarpal bone of the thumb, the first metacarpal, second, third, fourth, and fifth. The third row of bones are the phalanges, which are the small bones of the fingers. We have 2 phalanges for the thumb on the lateral aspect. We have 3 phalanges for each finger. We have proximal, intermediate, and distal phalanges in each of our fingers. Carpal bones also articulates with the distal end of the radius, forming what we call the wrist joint. The wrist joint is an articulation between the distal end of the radius and 3 of our carpal bones, which are the scaphoid, leonate, and triquetrum. The articulation, which is the wrist joint, is of biaxial synovial type. It's an ellipsoid synovial joint with 2 axes perpendicular to each other, articulating of a synovial joint. Regarding the capsule and ligaments, giving the stability of the wrist joint, we have to know the attachment of the capsule. The capsule is attached to the distal end of the radius on one side, and the proximal end of the 3 carpal bones articulating with the radius, which are the scaphoid, leonate, and triquetrum. The capsule is reinforced on both sides by 2 collateral ligaments arising from the radius and ulna, which are the ulnar collateral ligament and the radial collateral ligament. Other than the wrist joint, the hand is full of articulations and needs more ligaments for stability of the bones. We have the carpo-metacarpal joints articulation between the carpal bones and metacarpal bones. All are plain synovial except for the first carpo-metacarpal joint. The first carpo-metacarpal joint, or the carpo-metacarpal joint of thumb, is a biaxial saddle type synovial joint. We have the articulation between the distal end of the metacarpal bones and the phalanges in the form of metacarpophalangeal joints, and it is of an ellipsoid axial synovial joint. The metacarpal bones are conjoined together with the transverse metacarpal ligament to stabilize the metacarpal bones during flexion, extension, adduction, and abduction of the fingers, without any of them protruding on either sides, dorsal or palmar aspects of the hand. The interphalangeal joints, either the proximal interphalangeal or the distal interphalangeal joints, are uniaxial hinge type of synovial joints. Regarding different movements of the hand, we have a versatile type of movements that could be done by the hand on different levels of joints. As for the wrist joint, we have two articulating axes perpendicular to each other, which are the horizontal axis giving us the flexion and the extension type of movements. Flexion and the extension, the flexion movement is done by both the flexor carpi ulnaris and flexor carpi radialis, assisted by the flexors or the long flexors of the fingers, flexor digitorum superficialis, flexor digitorum profundus. Have both extensor carpi radialis longus and brevis, extensor carpi ulnaris are the prime movers, and also the extension is assisted by the long extensors of the fingers. The other X, which is a vertical X running along the upper limb or along the wrist joint, we can move the hand on both sides with ulnar and radial deviation, termed the adduction and abduction. The ulnar deviation of the hand is called the adduction, and the radial deviation of the hand is the abduction. The adduction type of movement is performed by all muscles termed ulnaris, either flexor or extensor muscles. So flexor carpi ulnaris or extensor carpi ulnaris will perform the ulnar deviation or the adduction. As for the radial deviation or the abduction will be performed by muscles termed radialis, flexor carpi radialis, extensor carpi radialis longus, and brevis. Wrist joint can perform a circumduction type, which is a combination of movement between flexion, extension, adduction, and abduction. On other level of joints, we have the metacarpophalangeal joints, which are also ellipsoid synovial. They can perform also flexion, extension, and adduction and abduction. We have the carpometacarpal joint of the thumb performing flexion, extension, adduction, abduction, and opposition type of movement. As for the interphalangeal joint, it's an hinge synovial, so the only movement allowed in these type of joints is only the flexion and the extension type. Regarding the arterial supply of the hand is one of the parts of our body which is richly supplied by arteries and have different anastomosis between the radial and ulnar arteries. The first level of anastomosis is around the wrist joint, which is called the carpal anastomosis. We have two carpal anastomosis, which are the palmar carpal anastomosis and the dorsal carpal anastomosis. Both are formed by branches of the radial and ulnar arteries. We have the ventral carpal branch of radial and ventral carpal branch of ulnar. On the dorsal aspect, we have the dorsal carpal branch of radial and dorsal carpal branch of ulnar arteries. These two anastomoses receive also branches from the anterior and posterior interosseous arteries and may receive branches from the superficial and deep palmar arches. The second level of anastomosis in the hand is the superficial and deep palmar arches. The superficial palmar arch is formed mainly by the ulnar artery with the superficial palmar branch of radial, while the deep palmar palmar arch is formed mainly by the radial artery and deep palmar branch of ulnar artery. Both palmar arches will further give metacarpal and digital branches supplying every part of the hand, including, of course, our joints. Regarding different relations surrounding the wrist joint, the main relations around the wrist joint are on both the ventral and dorsal aspects of the joint. For the dorsal aspect of the joint, we have the extensor retinaculum stretched, which is a band of deep fascia stretched along the course of extensor tendons to fix them on the dorsal aspect of the hand. The extensor retinaculum is divided into 6 compartments, starting from the lateral aspect of the radius. These 6 compartments will surround the wrist joint from all the directions, as we can see in the cross-sectional picture. The first compartment contains the abductor pollicis longus and extensor pollicis brevis tendons. The second compartment contains 2 radialis muscles, which are the extensor carpi radialis longus and extensor carpi radialis brevis. For the third compartment contain the third muscle or the third tendon for the thumb, which is extensor pollicis longus. The fourth compartment contain 4 structures, which are the extensor digitorum, the extensor indicis, and an artery and a nerve. The artery is the anterior interosseous artery, and while the nerve is the posterior interosseous nerve. Finally, we have the fifth compartment, which runs between the radius and the ulna, and on the ulnar side we have the 6th compartment containing the extensor carpi ulnaris. On the lateral aspect of the wrist joint, we have an important space which is called the anatomical snuff box, related superficially to the lateral side of the wrist joint. The anatomical snuff box is formed of medially the long extensor pollicis tendon, and laterally from the abductor pollicis longus and the extensor pollicis brevis tendon. An important artery running in the floor of this anatomical snuff box, and its pulsation could be felt against the scaphoid bone, which is the radial artery. On the palmar aspect of the wrist joint, we have the flexor retinaculum stretched between scaphoid and trapezium. On the other side, we have the attachment to the triquetrum bone and the hamate bone. The flexor retinaculum runs fixing the long flexor tendons of the flexor digitorum superficialis and flexor digitorum profundus, with a special compartment for the flexor pollicis longus muscle. The median nerve runs inside the carpal tunnel below the flexor retinaculum, which is a dangerous position for the median nerve. It could be entrapped in this location and causing the carpal tunnel syndrome. Structures passing superficial to the flexor retinaculum are the ulnar nerve and ulnar artery, and the flexor tendon of the palmaris longus muscle. The ulnar nerve and ulnar artery are passing in a special compartment of the flexor retinaculum called the Guyon's canal. Also, it's a dangerous position for the ulnar nerve, where it could be also entrapped, forming the ulnar tunnel syndrome. Applying the anatomical knowledge and data revised or mentioned in our lecture, we could revise this case of a 50 years old carpenter visited his physician complaining of a severe pins and needles sensation in his right hand, which also involved the palmar surface of the thumb and lateral 2.5 fingers. If you revise the nerve supply or the cutaneous nerve supply of the hand, you can realize that these symptoms are similar to the areas of distribution of the median nerve cutaneous supply of the hand. Let's continue. He told the physician that the pain was becoming progressively worse and often awakened him during the night. He said that he has been experiencing difficulty using his tools and buttoning his shirts. Of course, these complaints explains or could be explained by weakening of his hand grip if the median nerve is also injured. During the physical examination, the physician did not detect objective impairment in the sensation of the hand, but she noted slight weakness in the thinner muscles. She told the man that he has nerve entrapment syndrome. Of course, by now, I think all of you realize that we have a nerve entrapment of the median nerve in the carpal tunnel, which is a famous syndrome called the carpal tunnel syndrome. All we need so far in this carpal tunnel syndrome is the relation of the median nerve in the medial, in the ventral aspect of the wrist joint below the flexor retinaculum in the form of carpal tunnel region. Thank you for your time with my lecture today. I hope it was a nice subject, and I hope it was an easy subject for you. The rest of the carpal tunnel will be furtherly explained with different nerve supply parts of the upper limb, especially nerve supply of the hand and branches and branches of the median nerve and the disabilities caused by median nerve lesion.